Today, the Texas House will debate Bill SB 22, the biggest threat facing Planned Parenthood this session. This bill aligns the attacks that have faced Planned Parenthood for nearly a decade, like when Planned Parenthood was kicked out of the state's family planning program, the Medicaid Women's Health Program, the joint federal and state breast and cervical cancer program, and the state ongoing action to remove Planned Parenthood from traditional Medicaid. Extremist members of the Texas legislature remain determined to block access to Planned Parenthood to score political points no matter what. This bill bans local governments from partnering with Planned Parenthood and will be devastating for cities and counties already facing challenges to provide affordable, quality health care to Texans across the state. Thankfully, we have House members and champions, including Representatives Gina Hinojosa, Representatives Lena Ortega, and Representatives Donna Howard, ready to stand with Planned Parenthood and fight to protect local health care that thousands of Texans rely on. It is my honor to introduce one of those champions now, Representative Gina Hinojosa of Austin.
Thank you. Thank you, Diana. I'm sorry that you have to be here fighting this harmful legislation on your birthday, but I am proud to stand with Planned Parenthood. Planned Parenthood is an integral part of the healthcare safety net in Texas cities and counties. And despite what proponents say about Senate Bill 22, it would not impact abortion services. In fact, Senate Bill 22 has nothing to do with impacting abortion services. What Senate Bill 22 is a statement that the Texas legislature is so anti-abortion that we're going to prove it by hurting women. Because what Senate Bill 22 does is take aim at the routine and life-saving health care services offered by Planned Parenthood, including birth control access, STI testing and prevention, HIV prevention and outreach, and breast and cervical cancer screenings. The Texas legislature shouldn't be making decisions on behalf of local elected public health officials. They are the ones who know how to best meet the health needs and health education needs of their communities, and especially when Texas has the lowest insured rate in the whole state, the highest number and the highest percentage of uninsured residents are in Texas. This is not a time to be limiting healthcare access for Texans. Much of the focus related to Senate Bill 22 has been on the Planned Parenthood Health Center located in downtown Austin. The building is owned by the city, and similar to many other partnerships, is leased to Planned Parenthood for a nominal fee. This is because Planned Parenthood is providing vital health care services for members of our community, many of whom are uninsured and already medically underserved. They have nowhere else to turn for care. This one health center in Austin doesn't need the entire legislature to spend limited legislative time trying to close it down. And this one health center in Texas isn't the only health care impacted. We should be spending our time finding solutions to get more Texans the health care they need instead of spending time on this hurtful, harmful legislation. Recent Texas research highlights that community college students don't have access to birth control methods they prefer, and in fact that's something that both Representative Howard and I have worked on over the interim, and that these are birth control options that help them achieve their academic and life goals and plan for pregnancy. To address this healthcare gap, Planned Parenthood initiated education and outreach efforts on community college campuses across Texas to help connect community college students with the birth control methods of their choice. With IUDs and implants, community college students can reduce their risk for unintended pregnancies and instead stay focused on meeting their college goals before planning a pregnancy. Essentially, this bill has broad implications and would hurt many people across our state, and that is why I stand against Senate Bill 22.
Thank you, Representative Hinojosa, for those powerful words. We're also going to hear from Representative Lena Ortega of El Paso.
Good morning. As you all heard, I am Lena Ortega. I represent District 77 in El Paso. And today, unfortunately, as you are hearing, is that we're set to debate House Bill 22. The purpose supposedly is to ban any leases with local governmental entities, but the way this bill is set out, it does a lot more than that. I mean, we cannot It bans goods or services between any local governmental entity and any organization like Planned Parenthood and any affiliate of Planned Parenthood. Last fall, I was proud to celebrate the opening of a Planned Parenthood clinic in my district. Currently in El Paso, as Representative Hinojosa said, we have, in the state of Texas as a whole, we have one of the highest uninsured rates. But in El Paso, it's even worse than that. I mean, we have significant gaps in our community, low income, even middle income women, what we consider middle income because of the fact that our wage rates are so low, that there's significant gaps in accessing health care, reproductive health care, including breast and cancer, cervical cancer screening, birth control, and equally important is health care education. And what we're doing here is we would be banning education as well. The opening of the Planned Parenthood marked an important moment of health care for my community by opening the door to more access and potential partnerships by building a healthier El Paso. Senate Bill 22 undermines local control and threatens to remove these important educational resources and necessary services that we need in my community and that we had just barely started to receive. Planned Parenthood had been closed for many years in my community. I'm standing here very determined to stand with all of the members, all of the women, all of the members in the House of Representatives that are against this bill that does harm not only to women but to men in the state of Texas.
Thank you, Representative Ortega. I also want to thank Representatives Alma Allen and Representatives Retta Bauer for joining us standing against SB 22.
I'm Sarah Wheat with Planned Parenthood Greater Texas, and I would like to invite a couple of the MDs who have been able to join us this morning, and I'd like to invite Dr. Weiss.
I'm here today to speak with my colleagues from the Austin medical community to highlight the sweeping impact of SB 22, HB 1929 in multiple cities in Austin. I have been in private practice with Women Partners in Health and Obstetrician Gynecology for 33 years, and I am also very familiar with Planned Parenthood. I was briefly, 5 or 6 months, an interim medical director about 10 or 12 years ago, and I'm very knowledgeable about the importance of this part of healthcare to the Austin community. It's not news that Planned Parenthood does provide medication and surgical abortions, but this bill will not impact those services, has nothing to do with those services. It is just a slap against Planned Parenthood providing any services to the community. It blocks access to basic health care and health education in the schools, in the community colleges, and in the clinic in East Austin, as alluded to by Representative Hinojosa. It also blocks access to basic healthcare and education services throughout Texas, El Paso, Houston, Dallas, and this bill should be opposed by all of us in a time when the legislature is choosing not to expand Medicaid, has continually cut back on women's health care. Public health issues are complex and specific to each community. Medical professionals need to be able to partner with medical experts and implement the best strategies locally with all available resources, including Planned Parenthood and other healthcare providers. I know even some of my patients, insured patients, had to go to Planned Parenthood to receive basic services because they couldn't afford their deductibles. I urge the House and the legislature today to reject Senate Bill 22, House Bill 1929.
Now I'd like to invite Dr. Rebecca Ting to join us and another OBGYN.
Yes.
Hi, I'm Dr. Ting. I'm an OBGYN here in Austin. I've I see firsthand how many patients are underserved and lack full access to preventive, affordable health care. Providing preventive services to low-income women saves costs to the state, primarily by helping women avoid unplanned pregnancy, averting Medicaid costs associated with pregnancy, birth, and infant care. For decades, Planned Parenthood has partnered with local governments in Texas to provide needed health care, education, and outreach, including providing cancer screening, sexually transmitted infections testing, and HIV prevention and Zika prevention outreach to at-risk populations. SB 22 sets dangerous new precedent by allowing the state to limit all available healthcare resources in local communities. Please respect the healthcare needs of Texans and the warnings by the doctors who are here today and oppose Senate Bill 22. Thank you.
And I think the most important voice here today that we don't get the chance to hear from as much is the patients that we serve. And we want to invite one of our patients. Hello there. My name is Natalie Below. I'm a registered respiratory therapist, and currently I'm a student at University of Texas School of Nursing. I'm seeking my Master's of Science in Nursing and will ultimately graduate as an advanced practice nurse. Today, I'm married, I'm secure in income, and I have health care coverage. But that certainly was not always the case. For almost 20 years, Planned Parenthood was my doctor. I was a young woman working in the service industry or as a nanny, and like a lot of people like me, I didn't have health care. Instead, I relied on Planned Parenthood, where I could access health care on a sliding scale. Not only was Planned Parenthood health care affordable, but it was high quality, compassionate, expert care like birth control, essential cervical cancer screenings, breast exams, annual exams, and much more. In 1993, at one of my annual doctor visits, a nurse discovered a small lump in my breast that I had no idea was there. The threat of breast cancer was something I shouldn't have to worry about for a long time, but there I was, 19 years old, worrying about that possibility. They referred me to a list of doctors that accepted patients that didn't have health insurance, and I was able to move forward in my treatment, and today, I'm okay. My life would have gone way differently had I not been for the essential routine preventative health care that I received at Planned Parenthood. And that breast cancer scare would have been far more frightening, way more confusing had it not been for the guidance and the resources that Planned Parenthood provided me. Today, there are so many young people out there that are just now starting, and they're working so hard, but they still can't afford the health care that they need. And it's crazy, but it's even harder to find accessible and affordable health care now than it was for me as a young woman in the 1990s. Yet we are pushing back against efforts to make it even harder. I'm here today as a healthcare provider, as a taxpayer, as a voting citizen, because when I needed care, it was there for me. The citizens of the great state of Texas need more access to health care, not less. It's time for state leaders to stop playing politics with our health care and stop Senate Bill 22. Thank you very much for that.